I would like to talk about Ozempic face and what is it. Today, people are taking these medications for weight loss, and they're called semaglutides. And we know them as Ozempic, Mounjaro, Wegovy, for example. And people want to know, what is this Ozempic face? And Ozempic face is a gaunt, hollow face that has lost volume and is sagging. What are signs of this? Well, you're going to lose volume in the cheeks, sagging skin, jowling along the neckline, hollowness under the eyes, we call that the tear trough, deepening of the nasolabial folds, and appearance of neck bands. So why is this happening? Well, it's not just because of the medication specifically, it's due to rapid weight loss. And as people lose the weight very quickly, this skin can sag. And that's due to the amount of collagen that we have in our skin and the elasticity of the skin. And people lose weight, and if they're elastic, their skin is elastic enough, if they have enough collagen, sort of fortitude there, it doesn't show that much. But as patients begin to age and these things happen, wrinkles and sagging occurs. So one important thing I think about is that when we look at someone's face, we look on the outside and we see the skin more or less, and we see the structures. But really, this is example, the skull is what is really underneath. And as a plastic surgeon, we think of the surface anatomy, but we're also thinking about the underlying anatomy. Part of it is the bone that remodels, but also as we lose weight in a short period of time, weeks to months, we begin to see things like the tear trough. This is around the orbital rim. We begin to see the bony orbital rim. This would be the cheek, and the cheeks become hollow or sullen. And these are the areas that, as a plastic surgeon, we want to analyze and treat. So I would say, let's talk about the treatment for this. And fortunately, there aren't treatments for it. So it's great, you've been on semaglutide and you've lost some weight, but now you're noticing these changes in your face. And you're like, well, what could I do? I want something to match. I have this great body now. What about my face? And this is what we can do. Well, one of the things, there are two categories. There are sort of the non-invasive or injectable category. And those would be things like Botox that will smooth wrinkles out. And also there are fillers. And there are different types of HAs or hyaluronic acid fillers, and they work immediately. And depending the amount of loss and how much correction, that can be done. There's also another product, a very innovative product called Sculptra. And it's these little particles, PLA molecules, and we inject them. And then over the course of 4 to 6 weeks, your own body stimulates collagen, and it really helps volumize the face. Rather than just sort of pinpointing an area, say along the nasolabial fold, it's a global upper, middle, and lower third of the face rejuvenation. And the other thing that plastic surgeons can help is with surgery. And surgery will correct things often more permanently, and once again, naturally, by correcting the upper and lower eyelids due to sagging skin, lower facelift, mini facelift, and neck lift. So based on what your needs are, the plastic surgeon can analyze this and come up with a treatment plan that will help restore your face and give you the volume and the youthfulness and the contour and the convexities that have been lost along the way. Thank you. I hope this was informative. Please feel free to contact me if you have further interest. Thank you.